Welcome back. A growing number of unemployed or underemployed people across the country are facing economic hardship right now. So how are insurance companies helping those people who need medical care? Well, joining us over video chat today to talk about that is Tara Mullins with Health Alliance. Good morning, Tara. How you doing?
Good morning. I'm doing well. Thanks for having us.
Thanks for being here. So first and foremost, we want to talk about the options that people have who have been affected by COVID-19 and maybe don't have insurance right now.
Yeah, absolutely. A lot of the things that we're seeing are, people maybe losing jobs or changing their retirement timeline or things like that. And so options for people really Medicaid, Medicare, healthinsurance.gov, which is sometimes referred to as the marketplace. If they've lost coverage through work, maybe COBRA or a short-term plan could be an option for them.
Perfect. And now what exactly is Health Alliance offering at this time?
Yeah, Health Alliance, we worked really diligently at ensuring that testing and treatment could be at no cost to patients. And then we accelerated and waived prior authorization process that sometimes can delay care. So we wanted to make sure that wasn't a part of delaying any testing or treatment related to COVID. And then some of the other things we've been encouraging is telehealth and virtual visits because we want to make sure that people can have the access to their care and not be out to do it. So that's been a big encouragement this time of year.
So some people might not realize that they are eligible to shop around for insurance plans right now. So can you talk about those people and actually who will be eligible right now to shop around?
Yeah, absolutely. So if they've had a qualifying life event, they've lost coverage through losing coverage through their employer. Maybe they had to move. I recently encountered somebody who moved back here from Florida during this time to be closer to family. So that would qualify them to get a new plan, or maybe a student moving home. And then a special enrollment period came up for those who were Medicare eligible that may have been affected by COVID-19 during January 1st through March 31st. They would have had an open enrollment period, but if they didn't make their changes during that time frame, that allows them an SEP, special enrollment period, that will run March 1st through June 30th to make changes to their existing Medicare plans.
And you mentioned that time frame, but why is it so important that people act now and sign up right away?
Yeah, the government's worked really well with everybody to make some adjustments through all of this. It's been a lot to go through, but a person has usually 60 days after they've had that kind of qualifying event to enroll. Outside of that, then they wouldn't be able to enroll in a plan. So they want to make sure they're doing that now. So we're June 10th today. So until June 30th, they have that ability to do so with the Medicare special enrollment period. But if they've lost coverage, say 30 days ago, then they have 30 days to make a decision.
And you know what, Tara, we actually just we ran a story about how people are not going to the doctor right now. So why do they need to keep going and keep visiting their doctors if they have any pre-existing conditions?
Yeah, we did see a little bit of a trend of the stay-at-home affecting people taking care of themselves, and so we want to make sure that if you have chronic health conditions, things like that, that you're really making sure that that's addressed. You can do that through a virtual visit. You can actually even use our Hallie app through Health Alliance and look for different ways to get care or to work with your Health Alliance care coordinator or things like that to make sure you're getting the care that you need. And calling your doctor's office, they'll help you guide through, should you come in? Should you, do a virtual visit? Is this an emergency? Then absolutely go to the emergency room and things like that.
Of course, people are scared right now to do really anything. And you mentioned those telehealth visits. That's been a big help for people during the pandemic. But I know a lot of people are worried that that might not be covered under their plan. Is it?
Yeah, on some of our Health Alliance plans, those are actually free, or some of them can be just like your primary care visit copay. So really can be reasonable for you, or some of them are free.
Good information this morning, Tara. We appreciate your time. Is there any place that would be the best place for people to go for more information? Because I know this was a quick conversation.
Yeah, we do have the healthalliance.org/coronavirus resource page where it gives all the up-to-date information around how coverages are changing, where you can interact with us in the community, whether that's a virtual event or something of that nature. So you can go to healthalliance.org/coronavirus.
Very informative. Thanks so much, Tara, for your time. We appreciate it.
Thanks for having me.